Hello, my name's Lauren Hendry. I'm one of the pre-treatment team leads at the NCCC, and my job role involves doing CT planning scans, MRI planning scans, or planning palliative treatment for patients. As a profession, radiotherapy is a very rewarding profession. I think if you like people skills and you like talking to people and caring for people and basically a patient-focused role, it's ideal. And I think, well, what drew me to the profession initially was that I really liked physics at school and biology, but I found it quite difficult to find jobs where you had both of those and people aspect. A lot of them were lab works or going to do scientific degrees, and I think that radiotherapy is kind of the best of both. You get those people skills, you get to be able to help and support people, and you also get to kind of work out the best treatment angles, look at biological factors, and I think that's one of the reasons I probably came for the job and found the job. People always confuse us with nurses. We're not nurses, we're therapeutic radiographers. It's a protected title, and basically you kind of have the two roles. You can either be a diagnostic radiographer or a therapeutic. You have to go and do degrees. It's basically half placement, half theoretical, so you spend half your time out working in a radiotherapy department, getting a feel for it, and you spend the other half doing the physics behind it and the knowledge and theory. So it's quite a good degree if you want a little bit of a mix of both, to be fair. I think that's probably what draws me more as well to pre-treatment, because I think you kind of have to have problem-solving skills. It's the first time you're meeting the patient. You don't know what's going to turn up on your doorstep. It could be someone who's just been told they have cancer. It could be someone who has one leg and they have poor mobility issues. It could be someone who isn't coping very well with a diagnosis or hasn't told their family. So I think we're the first port of call, and I think that's why I really enjoy the pre-treatment aspect of it, because you just don't know what's going to come through the door, and you kind of have to be adaptable and have those problem-solving skills. And I think feeling that once you've helped someone or if you've achieved a difficult setup, it is really rewarding. Or cannulation. If you find a really difficult person to cannulate and you manage to do it, there is a massive satisfaction that you've helped that patient. It definitely takes a certain type of person to do the job, and I think it's really important that you go and scope out a department and visit before you think about applying. Go and find a department, they'll literally happily take people in to see and get a feel for the area. I did that before I started, and I think there was a couple of people in my course who didn't necessarily do that, and they then found it just wasn't for them. So I think it's really important that if you are interested, go and try and find a department and get some experience just shadowing some people and see if it's for you.
Please visit the Northern Radiotherapy Network website if you have any questions or queries.